Hello, everyone. Welcome to Tutor IMG's short medical series. So in this video, I'm going to be talking to you about some clinical points relating to gestational diabetes. All women within Canada are screened at an average of about 24 weeks for gestational diabetes. The reason for this second trimester screening is usually because it's the second trimester when the placenta starts to secrete a number of anti-insulin-like factors that make it harder for the body to process glucose, right? So these hormones like HPL and HGH are placental hormones that rise in concentration in the second trimester. This is why gestational diabetes develops in the second trimester, whilst pre-existing diabetes may worsen. This is also the reason why women with gestational diabetes don't usually present with babies that have malformations as opposed to pre-existing diabetes, because gestational diabetes hits at a time when organogenesis has been completed. What it can cause is, of course, macrosomia. And this, in turn, can cause shoulder dystocia, which can cause acute complication of delivery. So usually, we do not measure women's levels till the time that they're 24 weeks pregnant. However, this can, of course, happen at 26 weeks as well, because the average that window is between that time frame. However, the way we assess for gestational diabetes can be done by two methods. There is what we call the preferred approach versus the alternate approach. Now, the preferred approach is called 50-gram glucose challenge test, whilst the alternative approach is a 75-gram oral glucose tolerance test. The benefit of 50-gram GCT is that it does not require fasting, right? No fasting needed. Here, the patient needs to be in fasting. This is going to last for about an hour, whereas this will last for about 2 hours. Very valuable time and very uncomfortable for the patient as well. The downside of this method is that it's a screening test, and if it yields a positive result, then meaning a positive result means that there's suspicion the woman has gestational diabetes, you have to do another test on another day. Usually, the other test is going to be the 75-gram OGTT. The upside, of course, to the 75-gram OGTT test is that it is a confirmatory test. So if done and if found to be positive, you don't need repeat testing. Now, another very important clinical point is how do you diagnose the gestational diabetes, right? Diagnosing it. So remember, for diagnosis, you just need one abnormal value. And this is different from when we're assessing a regular patient for diabetes, where we need two abnormal values, perhaps two readings on 2 separate days, or we need one abnormal value with symptoms of diabetes to diagnose them. Pregnant women, for GDM, you just need one abnormal value. This abnormal value can be the fasting or the random, when you're doing the 50-gram test. This can be a initial value, which is more than 5.3, a 1 hour value, which is more than 10.6, or a 2 hour value, which is more than 9. Whilst in the 75-gram test, you can look for a fasting value, because here the patient isn't fasting, of more than 5.1, a 1 hour postprandial of 10.0, and a 2 hour value of more than 8.5. If any one of these values comes back, as abnormal, you will diagnose the patient as being gestational diabetic. The first line therapy, when you get this, is going to be a lifestyle dietary modification, along with some exercise that you're adding to the patient's regime. But this is done just for 2 weeks. And if it's unsuccessful, then after 2 weeks, the patient is started on therapy, which is preferably insulin, regular insulin. Patients who are pre-diabetic or who do not wish to use insulin can stay on metformin. There are no tests to show that babies born to women who were taking metformin have any major side effects. Now, once gestational diabetes has been diagnosed and insulin has been started, you can't just leave the woman as such. You need to have follow-up. And follow-up will include you assessing her levels of sugar regularly and giving her, proper support and increasing surveillance in such a woman to ensure proper health of mother and baby. The outcome in such scenarios is that for gestational diabetes, you want to deliver the patient at about 39 weeks. You don't want to go beyond that. That's the ideal time to induce. Okay, so I hope these points help you on the boards. And if you like our videos, please continue to support us so that we can continue making such short videos to help you get through your exams.